Hi, everyone. Welcome to the Center for Innovation in Campus Mental Health webinar series. As usual, we're just going to take 1 minute or so for people to join us. Okay, thank you all for joining us today. The topic today is Evaluation 101, which is learning how to conduct evaluation of programs and services. Just a few items before we get started. You are on mute when we're on the call. We will be taking questions at the end of the webinar, so feel free to type in your questions using the question function on the menu. We're going to start taking them up around 1:45 or so. The webinar is being recorded and it's going to be made available on our website as well as our community of practice, which I will talk a little bit about at the end of the webinar. We do have a short survey at the end of the webinar as well, so please take a couple of minutes to complete it as feedback is really valuable to us. So I'm just going to introduce myself. My name is Perlin Ng. I am the Research and Knowledge Exchange Coordinator for the Center, and we are joined today by Radha Nair and Stacey McDonald. Thank you for joining us today. So Radha is the consultant hired by CICMH to develop our evaluation toolkit, which we're going to go into in a little bit. And Stacey McDonald is the Ontario Trillium Foundation's evaluation and learning specialist and host of its measurement community hub. Stacey has become a self-described hardcore evaluation enthusiast over her past 6 years at OTF. She's on a mission to help ensure communities benefit from evaluation as a vital tool to help them understand if they're doing the right things and if they're doing those things right. So now I'm going to turn it over to our experts. Take it away.
Hi, everyone. My name is Radha Nair, and I'm really excited to be part of the webinar on Evaluation 101, learning how to conduct evaluation for programs and services. And as Perlin had mentioned, I'm going to, I think Perlin's asking me to make this bigger. Is that right? It is. It is full screen here, yeah. So I'm going to take just a few minutes and introduce the project to you, and then I'm going to turn it over to Stacey to take us through the content on evaluation. So I'm very excited. The project is a really innovative one for the Center for Innovation in Campus Mental Health. Probably most of you are familiar with the Center. I'll just say a couple of things about it. It's a partnership project of, I'll take the lean forward. Okay. Forgive us as we work out some of our technical glitches. So CICMH is a partnership project of Colleges Ontario, the Council of Ontario Universities, the Ontario Undergraduate Student Alliance, the College Student Alliance, and the Ontario Division of the Canadian Mental Health Association. It really is quite an innovation in terms of collaboration in the post-secondary education sector. It's been working now for over 5 years to try to engage sectors. Is there an issue, Perlin?
Yeah, the screen seems to be lagging. I'm not actually seeing what you're seeing on your screen.
It says paused.
Did you pause your screen? I don't even. Give me 2 seconds. I'm going to come over and troubleshoot. There we go. Now we're good.
Okay.
So back to here, and where were you at? Here.
There.
Yep. Okay, we're good. Sorry about that, folks.
Sorry about that, everybody. We're just working out our technical glitches here. So I think most of you are familiar with the center. It is a partnership project, and you'll see the different organizations that are involved in the partnership. I think I'll keep going. So the mission of the center is to support Ontario's colleges and universities to enhance their capacity to support student mental health and well-being. And in order to achieve this mission, the center focuses on some key activity areas. One is facilitating a campus mental health community of practice. The second is coordinating access to expertise. And this webinar is an example of that. And the third is fostering and supporting innovation. And the center is involved in several different projects that are geared to innovation, including looking at how different campuses across Ontario can collaborate to share information, to implement joint projects.
Sorry, just coming in for a second. Maria says that you guys are on mute. Nobody can hear you. Sorry to our audience who are watching this. Can you hear us? Can you, if you can't hear us, can you please ask a question or type something in the chat? Because you are not on mute, because it doesn't sound like you're on mute. Oh yeah, people can hear you. So
okay, great.
It's just Maria. My apologies.
So the center is funded by the Ministry for Advanced Education and Skills Development. Probably most of you have already seen the center's website, and it has lots and lots of amazing resources, information. There are several webinars from the past that have been recorded that you can access. The center also does a really wonderful annual conference where they bring all kinds of experts in different areas related to student mental health and well-being. So there's lots there for you to access and to engage with in terms of the center. So about this project, certainly over time, the center has been hearing post-secondary education sector stakeholders talk about a desire to better understand how to evaluate the programs and services that they've been providing to students when it comes to their mental health, and also to provide support around addictions. The ministry was also thinking a lot about evaluation and had it on their radar that projects that they support, that they fund, that they work with should have the opportunity to build capacity when it comes to evaluation. And there were some clear reasons that were emerging for that. Campuses were telling the center that they wanted to mostly learn about how to do a better job when they were offering supports to students. Also to look at how to enhance their sustainability efforts and to tell their best story to diverse groups of stakeholders. So in conversation with the ministry, the center launched a 2-year project that is focused on evaluation and capacity building. And this webinar is one of the key offerings of the project. So just a bit about the goals and the activities of the project. Primarily, the project will develop and disseminate resources that aim to build the capacity of colleges and universities to evaluate mental health and addiction services. And we're doing that with some partners, and I'll talk about those partners in a moment. In terms of the resources that we are going to be offering, we're going to be going through quite an interactive process to validate them and pilot them. So the idea is to offer resources to stakeholders and then get ongoing feedback about the usefulness and the effectiveness of them as we go through the project. We're also going to be supporting the identification and development of mental health and addiction evaluation champions across Ontario. And our hope there is that we're going to build an evaluation community of practice with evaluation experts, but also those who have experience of implementing evaluation on the ground. And that's going to culminate in some recommendations to the ministry and also out to the sector on how to further build the capacity to evaluate the work that folks are doing. So our key activities, one of the first things we focused on in the first year of the 2-year project is developing an evaluation toolkit. And today is technically the launch of that toolkit through this webinar. So the toolkit is targeted to mostly people that are providing and managing frontline services and programs on campuses. So for example, those of you that are working in student wellness centers or counseling centers or accessibility offices. You see the link there. It's a really beautiful toolkit. It's meant to be interactive. It's meant to be easy to use. It targets probably folks that are earlier on in their learning journey when it comes to evaluation. As I said, we'll be looking for feedback from you. There'll be a feedback form that you can fill in when you use the toolkit. We'd love to hear from you in terms of what's working, what isn't, what are some of the gaps that you'd like to see filled. And it's also going to be available in French and English, which is quite exciting for us. We also are linking to our partners' evaluation resources on the website. And those resources are wonderful on how to conduct evaluations, different approaches you can take to evaluation, how to use the results that you get from the evaluation work that you do, and lots more. You'll see our 3 key partners there, Ontario Trillium Foundation, and Stacey is here today to give us our webinar. Innoweave, which is a special initiative of J.W. McConnell Foundation, and they particularly focus on something called developmental evaluation, and the Center for Addiction and Mental Health, which has a number of resources related to evaluation and mental health services. So you're going to see lots of links on the website to some of their resources going forward. Again, in French and English, and lots of things to choose from. So we invite you to take a look. One of the most exciting parts of the project is that we have selected 4 campuses to work with an evaluation coach to use the toolkit and to use all the other resources to evaluate some element of their program and service. So the coaches are all working in post-secondary, in the post-secondary sector. They're either evaluators themselves or they're academics with a focus on mental health, or we also have mental health policy and strategy leaders. So the coaches and the sites will be looking at what the focus will be for each particular site and work together over a year to learn how to do good evaluation and to build evaluative culture. So those sites and coaches will be starting work in the coming weeks. That group of coaches will evolve into an ongoing group that will champion and foster evaluation capacity. So I've already mentioned that, and we'll be asking for you to get involved in that group in different ways. And I've already mentioned about the feedback on the toolkit and how we'll use it to hopefully continue the conversation about evaluation as we go along. So what should you do? Go to the link and look at the toolkit and start to use it and provide feedback on it. We'd love to hear from you, as well as the other resources that are available. Please share those resources with your colleagues, and you can start the conversation about evaluation if you haven't already. I've got my email address there. If you have any questions about the project or any questions about the resources, any of you can contact me at any time. So now I think I'll turn it over to Stacey to get into our content.
Great. Just give us a minute while we switch presentations. Hi everyone, so I am Stacey McDonald from the Ontario Trillium Foundation. Thank you so much for having me here today to talk about one of my favorite topics, evaluation. I have a bit of a cold, so please bear with me if I need to stop and blow my nose. Just one second. Okay. So there's a lot to cover in the next half hour, so I'm just gonna jump right into it. What will we cover today? Oh no. I just realized that the formatting of the presentation seems to be a little off, the font, so hopefully it doesn't affect things too much. So Sorry about that. Just threw me for a second. So what will we cover today? I'm going to describe what is evaluation, why it matters to your work, and then briefly, ever so briefly, cover the basic components of an evaluation. So what is evaluation? So I have a couple short definitions here. So it is the systematic gathering and interpretation of information about a program to help decision making. So it's really all about asking questions and using what you have learned to move forward. If you ever feel overwhelmed by the process of evaluation, bring it back to this idea. I have a question I want answered to help me learn and to help me do my work better. And so it's focusing in on that question and what is the information we need to know to answer that question to help us do our work. So what are some different types of evaluations? There's all kinds of different types, and different types will help you learn different things to help you in your work. Some types lend themselves better to different stages of your work, so that's why I like to share them along this continuum. So as you're developing a new program, a new idea, you might want to think about doing something like a formative or a developmental evaluation, and that will help you tweak the design of your program and make early improvements. So it's all about learning as you go and adapting as you go. Next, so once you have a pretty good idea of what program you want to deliver, service you want to deliver, and you're ready to implement it, you might want to learn how that's going. So you might want to do something like a process or an implementation evaluation that can help you improve your work, understand how it's being implemented, and help you understand things like to what extent your program is being implemented as you hoped it would be, and whether the program is accessible or liked by the participants. So the results of these evaluations can help strengthen your program and can help you inform future iterations. Finally, we have outcome, impact, and summative evaluations. These look to understand the effectiveness of your program in achieving a set of outcomes. Impact evaluations go a little bit further by considering intended and unintended outcomes. And summative evaluations are usually used to consider make decisions about whether you want to go forward with continuing to deliver a service or not. But what I'm gonna focus a lot on today is outcome evaluation, and that's evaluating your program to help you know if it has worked. And by worked, I mean, did it achieve the outcome you aim to achieve? And often to what extent? So this is understanding if your program changed behavior in a participant and to what degree. And it helps you really be able to then understand, is what you're doing effective, and be able to tell the story of that. And now a lot of funders, including the Ontario Trillium Foundations, have more of like an outcomes-based approach, and so it is often really important to look at how do we know what we're doing is being effective, how can we report on outcomes, so outcome evaluations can be a really important tool. So now, this is not to say that you can't combine different questions from different types of evaluation in one evaluation. You might want to know things related to the implementation and to outcomes. This is just to kind of help you get your mind around there are different types of questions I could ask that would help me learn different things. So why would you want to evaluate your program? So evaluation can help you do a lot of things, including help you learn and improve the design and implementation of your program. It's a really great tool to help you learn about what's working, what isn't, and help you make decisions. It can help you answer things like, did we do what we said we were going to do? Did we reach our targets? Why or why not? Not only can it help you learn about what's working or not, it can help you reflect on what's happening. So take time to take stock about what is going on. Is it what we thought would happen or not? And what could we be doing differently in the future? It also provides a lot of great information that can help you generate ideas about moving forward. It could help you answer some key questions that have been lingering in your mind that you want to know. And I think most importantly, understand if your work is contributing to positive changes and demonstrate that impact, which is so key to help telling your stories to both donors, funders, and to help you be accountable to your stakeholders, including the people that you're serving. Knowing exactly where and how your program has worked or it hasn't can help you really improve it and make your program as effective as it can be. It may seem like a daunting task if you've not done it before, but it doesn't have to be. We often do little pieces of this every day. We ask ourselves questions like, was that how it was supposed to happen? And this just formalizes those questions and that process and helps us create a plan to do that in a systematic way. So evaluation should be first and foremost useful. Oh, okay, something's missing from that slide. Sorry, another. So it should help you learn about what is important to you. So you want it useful, you want it to be relevant and timely, because what you want that information to come when you can act on it. And while there may be a lot of different things where you want to know, evaluation is going to be most helpful if you can really hone in on what are those key things you need to know. So it should be pretty specific also. It can be expensive, really intensive research, but it doesn't need to be. It doesn't need to be a pass or fail or expensive or really labor intensive. You can get what you need out of it, and by looking at what are the key things I need to know and what's necessary for that. Of course, it might be wonderful to learn all kinds of things, but by keeping it specific and on the most useful things for your work, you can pare it down to something that is manageable. So what are the basic components of an evaluation? So most evaluations follow the steps outlined in this cute little diagram. It may deviate to it, but generally what we see is that we first want to determine what and why you're evaluating. So you need to define the purpose and the parameters of evaluation. What's in scope, out of scope. Next, you need to figure out who's going to be involved. So who are your key stakeholders? And then one of the most critical steps is defining those evaluation questions. This is what helps hone in your evaluation on what are the things you really need to learn. Next, you're going to, based on what those questions are, select what information do I need to know to answer those questions. And then once you know that, you can pick what are the best ways for me to get that information. So that's selecting the appropriate methods. Then you're going to collect data, analyze it, interpret it, and then finally, you want to reflect on what you learned and take action. Use those results, create an action plan. Also, don't forget to share it. There are a lot of others that could potentially learn from what you've learned from your evaluation. So we're trying to promote the sharing of results. So before you begin though, before we get on to these steps, let's take a step back. You need to have a really clear description of your program, your program's goals, and how your program will achieve these goals. So without having this clear idea of these things, it's going to be difficult to move forward with the evaluation. And it might be, you might feel like, oh, these things are obvious, but it's always a great idea to take some time and to check in and make sure that everyone is on the same page about this. It's a really good opportunity to get clarity and consensus around the purpose of your program and your work. So first, defining your evaluation purpose and parameters. You want to ask yourself, why are you evaluating your work? The answer to this will help you move forward, will help you choose what type of evaluation you want to do, what type of data you want to collect. So is it about learning, either for improvements, so maybe an implementation evaluation, or to build evidence of success, so maybe an outcome evaluation, or to make decisions? Is it mostly around accountability to funders, beneficiaries, or partners? So what kinds of story will I need to be able to tell at the end? Might also impact how you go about it. So it will really help you focus on what you need to learn. Next, determine the main issue and then outline what's in and out of scope. And that question is to help you figure out, what can you influence? So if evaluation is all about taking action and moving forward, you want to focus on those things that you can influence. So next, identifying your stakeholders. So your stakeholders are anyone with a vested interest in your organization's work. That could be anyone benefiting or contributing towards your work, or anyone who would be interested in your findings. This can be a daunting task. Hopefully I'm going to make the case that it doesn't need to be, but you don't have to do it alone. You can have a team that is working with you that includes your stakeholders, and they can help in a lot of ways, including influence how findings are used, can enhance the credibility, can add technical guidance, can generate buy-in, can add a new perspective, and can add day-to-day operational influence, so to make sure that the evaluation data does get collected and used. So the next step is developing evaluation questions. So this, I think, is one of the most important steps because it really influences everything that follows. So evaluation questions establish what you were trying to answer in your evaluation. They're really important because they will help you focus your work to make sure you learn what's important to you, guide your evaluation planning to make sure the next steps are in line with your purpose, and inform how you use the results. So next, let's look at an example of an evaluation question. So is this a good example? Do young people feel safe, included, respected, and empowered? Now, there's a lot here. Let's take a look at what might be a better option. So I've made some changes here. To what extent do young people in our program feel safe? So we want to be really specific. The safe, respected, included, empowered, that is a lot there. So let's focus in on what is maybe the most important thing for us to learn. And in this case, it might be safe. We want to avoid yes or no questions, and we want to be able to maybe quantify the result. And so that to that end, we want to add something like, to what extent? So a yes or no, it might not be that helpful. We want to know how much, to what extent do people feel safe? So here are a few other tips about developing evaluation questions. So have a clear link to the purpose of the evaluation. Avoid asking 2 questions in one. Address 3 to 5 very specific issues, so not too many. Really hone in on what's important. Ensure you can answer each question. Be sure that they are realistic, given the time and budget, and do involve stakeholders. Get their feedback on whether they feel like these are really the most important things to ask, and whether they're really going to lead to future improvements in your work and help your work move forward. So next, planning your evaluation. So there's a lot here. And in fact, one of my colleagues, Sarah, has created a webinar just on these steps right here. So I'm going to breeze right through it. But if you're interested, you can check out Ontario Trillium Foundation's YouTube channel. And we do have some webinars, so videos recorded in French and English. And one of them is on this stage covering this. But in a nutshell, what you need to do is choose your team and assign responsibilities. So you want to set yourself up for success by choosing the right team. So you might want to consider program staff, key stakeholders, and if you need outside help, you want to identify a team leader. This could be an evaluator or not. You want to really rely on your team for feedback throughout the evaluation. And you want to assign tasks to specific people on the team, and also lay out expectations and timelines. Next, you want to consider what's the best evaluation approach for the purpose of your evaluation. There are a lot of different types of evaluation. We touched on some, like implementation or outcome evaluation. There are also different approaches. So that could be something like utilization focused or empowerment evaluation. And there are also different designs, like experimental or not. So there are a lot of great resources out there. You don't need to necessarily understand all of these, but there are a lot of resources. What you need to know is that there are different frameworks around evaluation. And depending on what you want to do, they can be really helpful because they can help guide your evaluation, offer suggested methods, tools, and techniques associated with them. The next is you want to determine what data you need to collect to answer your evaluation questions. You might want to consider what type of information you need and from whom. So is it individuals you might want to interview or do a survey? Or is it more from groups? So do something like a focus group. You could look at collecting how people are behaving in a group setting, or depending on who it is. For example, is it someone that might have developmental delays? And so maybe something like using staff or volunteers to collect observational data might be more appropriate. And then you want to pick the best methods depending on what it is you need to know, and move forward with those methods. And then finally, develop your budget. So you need to have, this can be, a really great exercise in terms of, is it realistic? Checking, can I really go ahead and do this, collect this information, use these methods based on the budget. So it's better, I would say, to scale back and do what you feel like you can do well, even if that's just focusing on 3 evaluation questions than a broader scope. So next, just a little piece of advice around collecting data. Only collect what you need to know. So make sure that every piece of data you collect will help answer one of your evaluation questions. Don't collect personal data that you don't need to know to answer a question. You don't want to be responsible for that if it's really not necessary. And then it might just, confuse what you are trying to learn. So just really hone in on what is it I need to know and collect information for that. And that will help really focus your work. Now, when we talk about data, it's hard to really discuss different methods and different ways without quickly going over what two types of data there are. So so we have quantitative data and qualitative data, and they can help us learn different things. And there are different methods associated with different types of data, as well as different ways to analyze that data. So just a flyby overview of these two types of data. So they have different goals. So quantitative data is more about discovering facts, and really good if you want to understand causation, if you want to do something like hypothesis testing. Qualitative data is more useful if you want to learn what people are doing and why they're doing it from the participant's perspective. So it's really about expanding on the meaning. The questions quantitative can answer more around what happened, when, for whom. But qualitative questions can be really important about, okay, we know if something works or didn't, but why did it work, or how did it work? Why did it work for some people and not others? So it can really help in building that meaning about what really, why something happened or didn't happen. It might be easier to collect quantitative data from a large number of people, and qualitative data can sometimes be very useful. You don't need a very large sample. Sometimes you can get quite a lot of information from just interviewing 10 people. And so it allows you to maybe hone in on a smaller group of people. The data, quantitative data, is measurable, and it can be gathered through things like surveys, whereas qualitative data is more around behaviors. It could be observed, it could be written text, and it's collected through things like interviews to enhance understanding. So how you would analyze those two things: for quantitative analysis, you do mostly statistical methods, whereas qualitative data, it's more about analyzing for themes, understanding what are some patterns, what are some key themes that are coming out, and it's less about having a number associated to something, but understanding the meaning and the themes that are developing. Just checking the time. I need to maybe pick it up a little bit. So just one more note on that. So neither is better or worse. Actually, both work really well together. So what we try to promote is a mixed methods approach of both using quantitative data, understand what happened, qualitative data, maybe understanding why it happened. So that can really provide the best story to understand what's going on. So a few tips around analyzing data. So depending on what data you collect, you would have different methods, but regardless of the type of data and the methods, just some quick tips is you want to concentrate your analysis on answering your evaluation questions. You might be curious to find all kinds of other things, but really try to hone in again on your evaluation questions. take time to review and reflect findings. So especially qualitative data, something like interview, you want to read and read again, and maybe read a third time, and take time to really reflect. Ask yourself things like, were there results that surprised you? Is this what you expected to see? Are there things that maybe you need to further investigate? Analyzing information, it's really about looking at what's happening, why it's happening, what are some trends or patterns that you can see, and how that can help you make sense of your work and moving forward. And one of the ways that can help you do that is by visualizing data. So it's another way to help you kind of make sense of it, and also to tell a more compelling story. So finally, you've done your analysis, you reflected, now what? So you want to summarize your analysis and then engage your stakeholders in that reflection period. Like, present your findings. This is what we found. What does it mean to different people? They might have different perspectives, see things that maybe you didn't. And so it's really great to reach out to your stakeholders and to work with them to create an action plan for moving forward. You want to maybe discuss with them about, what's working well, what can you do better, what can you act on now, what do you need to investigate further, as I've said, what really stands out, what story is coming out of this. And then finally, share what you've learned. So many others might be doing similar work to you and could really benefit from your learnings. And so once again, I'm going to suggest to share what you've learned. So as kind of a wrap up, I'd like to just reiterate a couple things. So have a clearly defined evaluation purpose. Ask actionable evaluation questions and choose methods based on these questions. Check that your plan is feasible and realistic. How you conduct evaluation matters. So conduct evaluations in an ethical manner. Consider cultural appropriateness and equity. This could be a whole other topic. I just wanted to throw that in there. And then once you have your findings, don't let an evaluation report just sit there. Do take action. So one last thing. Want to learn. If you want to learn more, hopefully, if this is somewhat of a new topic for you, you want to learn more, the Ontario Trillium Foundation has developed a free e-learning course on evaluation, which provides a bit more in-depth information on all of these concepts, and you can access it at this web address here, otf.ca/knowledge. And as I've mentioned before, we have different webinars recorded in French and in English, and the course is also in French and English on our YouTube channel. So that's it for the presentation. I think I stuck to my time, and that's hopefully great. We have a good amount of time now for some questions.
And maybe I'll just say, that those links will be on the CICMH website as well, to the e-learning course and the YouTube channel. So it'll be easy to access either through this webinar or on the website.
Great.
Okay, so now we're just going to open it up for questions. As I mentioned earlier, you can type in your questions using the question function.
Can we see the questions too for them? No?
You can on your end.
Okay.
Yeah. So just wait a couple of minutes in case people have anything.
That was a lot to cover. Hopefully I didn't overwhelm. But maybe one of the questions, if anyone has any questions more about I think the most important thing is focusing on the purpose and figuring out, why I want to evaluate and letting that kind of lead you. So any questions?
And so if a counseling center, for
Right.
example, on a campus is interested in trying to learn more about the effectiveness of their work, if you could say, well, here's the first step and the second step, the first 1 or 2 steps for that counseling team to take.
Right.
They're all interested, then what should they do next? What's the next thing to do?
So I think it's sitting down as a team, and I said one of the great first steps is really clarifying, what are our goals. So what outcomes are you trying to achieve, and how do we know if what our work is actually achieving that? So for a counseling team, what is it we're trying to achieve with our clients or our customers? What do we want to see happen? And I think really the first step is having that conversation about really being clear. What is it we want to see as a change, and how do we know? How do we know whether that's happening? And if we don't know, how can we know? What are some things that would help us understand if we're really achieving our goals? So that like goal setting process and that reflection of, do we know? And if not, how could we know? And that hopefully can help start the conversation.
So we do have just one question rolling in here just now. What are your thoughts on receiving pushback from staff during the evaluation process? And that was the question, and I guess what they mean is that people not wanting to take part in evaluations when you're evaluating the program.
Sorry, I just muted that for a second and hit it on my nose. So I think the first thing I would say is that is really likely, and accept that that's likely. And one of the great ways to kind of head that off is to involve those staff in part of those early discussions. When we talked about, setting an evaluation team, you don't need to do it alone, and having stakeholders. Those stakeholders could be internal staff. It could be frontline people. It could be volunteers. It could be people working with your clients. And so having them part of the conversation so that from the beginning, they can voice concerns, can help you choose maybe the right methods. So if there's concerns around, well, we don't want to, one of the things we hear from our own grantees is we don't want to alienate the people we work with, or we don't want to offend them, or we don't want to have the evaluation be a barrier to participation. So by having even those participants, if you might want to take a participatory approach, even having participants or beneficiaries and frontline staff as part of that evaluation team can help really at the front end kind of have those open conversations and address that, because it is likely going to happen. So you might as well involve them in the process, and then hopefully if they can see the value in what you're doing and help guide your work to make sure that you do take maybe methods and approaches that are best for the people you're working with. They can add a lot of value.
Yeah, I think the other thing, I think resistance often comes from overwhelm around the work to be done. I think most people don't know, are still on a learning curve when it comes to evaluation. So when Stacey was commenting earlier about keeping it simple, I think that's really, really important. You don't have to necessarily evaluate every aspect of the service that you're providing. It goes back to what Stacey was saying about determining
the one or two key things you're really interested in learning more about. So not, well, we have to evaluate everything, but we're particularly interested in looking at what happens for our clients in terms of resiliency and how that plays out in their relationships. Right away, that's got a lot more focus than we have to evaluate all the counseling work that we do.
Yeah.
And I think that if you start with something small and get folks really engaged, as Stacey is saying, and get some interesting results from that, the interest to do more evaluation across more of the service will grow over time. That's what building evaluative culture is about.
Mm-hmm. And then once people can see, as you said, the result and how it could really play out and improve your work, then it doesn't need to be this. I know it can seem daunting, but yeah, if you really focus on, you could just start with one or two things, as you said, and start there, start small, and then go forward from there.
Yeah, I think it's okay to think about one or two questions and have a very limited scope in terms of the data that you're going to gather, and what that means for the tools that you're going to use, and just really keep it limited, even for the first, I don't know, even for a half a year or a year, and see how that goes, see what your results are.
Yeah.
And then build it from there. Take the long view in terms of becoming fully up to speed when it comes to evaluating programs and services.
Yeah.
That's great, guys. Thanks for that really thorough explanation. We just have a couple more questions rolling in here. So how do you evaluate a program that is fragmented when there isn't enough benchmarks on having a full campus mental health strategy or not capturing statistics on mental health?
I'm not entirely sure I understand what is meant by fragmented in this case.
So there's like a follow-up question.
Right.
It says, for example, we don't have specific programming to the larger issues on campus that we see, like depression, anxiety, relationship concerns, and addictions. So how do we measure what is needed? Like groups? Let me see if there's going to be further follow-up to that.
I think just to follow what we said before, you can start with one aspect.
Yeah.
And even if your strategy is evolving, and a couple things as I'm saying that if your strategy and your work is evolving, then maybe it's more beneficial to take something like a developmental evaluation approach, where it's not so much about measuring outcomes because you're not entirely sure where you're headed, but it's helping you along your journey. It's helping you kind of I think I like to think of developmental evaluation as an intentional reflective process that helps you think about what you're doing as you go and can help really build out that strategy. Or if it's more about, you're not working in all the spaces that you'd love to be working, it might be pick one aspect, focus on that, and then maybe if you can have some results to show on that, it'll provide kind of a case to move forward on some other items, other issues. Do you have something to add?
No, I think it relates to what you said, which is to determine your own focus and to keep it relative to your capacity, your time, your budget, the things you're really interested to learn about. This might sound oversimplified, and I don't mean it to, but the reality is that most campuses and the sector more broadly are not at the place where we have necessarily good, solid, reliable, perhaps baseline data that you were referring to when it comes to things like depression levels in students or anxiety or incidence or severity of mental health. I mean, I think that journey is evolving in the sector. And so I support you to let that go a bit and think about it from the point of view of your service and see when you start your journey around evaluation, you'll get initial data, and then you can continue to build out over time your evaluation plan, and then start to compare your results year over year. That's a really good piece of work for you to do to actually help the broader campus story get going, and to help the sector understand better, which is Stacey's earlier point about sharing results. So I think it is interesting to do work as a service within a sector, because we have these certain demands that sometimes the larger sector has on us, or that funders have on us, and it can be overwhelming to meet them. But I think if anything, as I listened to you, I thought, okay, stay focused on what you're doing and where you're at as a way to start, and you'll definitely have benefit from that as the broader conversation on your campus or the sector kind of continues, I would say.
Okay, so I hope that answered the question. So moving on, have you ever experienced when you begin an evaluation of one outcome and then you discover that you should have evaluated something else instead, and you're partway through the process?
That's a good question.
Well, that happens. That is a very important learning, which is why I think I stress the point of like taking time in the beginning to reflect, like before you even start, and checking in with stakeholders and your team about what really are our goals, and doing something like, you know, there are tools and methods, something like a logic model or a theory of change. Going through that process can help you kind of avoid that, but it might happen. So I guess your question is, what do I do once that happens? I guess it depends, like how far off the mark were you? You might want to take a minute to assess, okay, what data am I collecting? Will I be able to use that data to help me answer a different question? Or do I need to kind of let go of the methods or the data that I'm collecting? To my point, only collect what you need, and then, you know, rejig. So maybe the approach that you had used doesn't get the data you need. So take a step back. I would say it's better to pause and refocus than just, you know, continue on.
Yeah, I would think so. Maybe that's easy for Stacey and I to say, because we're not the ones who have to sort of be accountable back to stakeholders. But you don't want to keep going, because at the end of the day, if you know that it's not the right thing to be measuring, that could end up having a negative impact on the story you're trying to tell, and the goals you're trying to achieve around being accountable and the sustainability, et cetera. The other thing that comes up for me.
Oh, okay. I have one more thing I want to.
Do you have one more thing?
Yes.
Go ahead.
I was going to say, so I work for a funder, and I know there's a lot of fear sometimes about going back to the funder and saying, oh, this isn't what we thought it was going to be. I know from my experience that that fear, while is very real, should never stop a conversation about we need to maybe adjust to what we're doing. So our approach as a funder is we'd rather, you know, upfront, as soon as an issue comes up, to address it and to have some flexibility around, okay, maybe things need to be adjusted, and that's fine, because it's completely feasible that, like, as you go along, that things might not happen exactly as you anticipated. And so your funders might be completely open to that. So don't let the fear of that stop you. Have kind of an open, honest conversation about what's happening. And from our perspective, that is always welcome. Yeah. that's just what I wanted to add.
That was really great having that perspective. So I don't think we have time for any more questions. Rather, you had a couple of things to say just to wrap up.
Yeah, just to say that the toolkit and the links to the Trillium resources and Innoweave and CAMH are all there, and if you are coming in the next week or so on the website. And we really do want your feedback on the toolkit, and we want this to be a conversation in terms of the sector stakeholders and the folks that CICMH has a relationship with. So my email address is part of the presentation, and I do encourage you to email me if you've got questions or if you want to talk about the toolkit at any time. It would be really great to hear from you, and share it with others as much as you can.
Yeah. So thank you so much for presenting with us today, Stacey and Radha, and thank you everyone for joining us. Now I'm just going to take one quick minute and talk about our community of practice. We've partnered with EENet at CAMH to host an online space where webinar participants can continue to ask questions and post discussions about the webinar. So I'm going to post the link right now in the chat box so that everybody can see it. And it's also going to go out in the follow-up email. So I would encourage you to, to sign up to EENet. Like, there's lots of stuff. If you sign up to EENet, you also get access to everything else that is on that CAMH platform. So it's not just our community of practice, but tons of other groups as well. Although hopefully you come to our group mostly. And so, yeah, and the slides from the webinar as well as a recording of the webinar is going to be made available on that platform as well as our website. And our next webinar is a collaboration with our counterparts from BC and Alberta that's happening on May 1st. It's going to be about creating a campus-wide mental health strategy. So do check our website for a registration link. And once again, don't forget the survey that's going to pop up at the end of the webinar. Thank you so much, everyone, for attending.